You may have heard the saying, an apple a day keeps the doctor away, and drink 8 glasses of water. But are these true? We invited back our good friend and colleague, Dr. Freda Lewis-Hall, the Chief Medical Officer of Pfizer, to help bust some myths. Thank you. We're going to bust some myths, you and I together. Let's get started.
Hi, docs. I love to crack my knuckles.
But I keep telling him that cracking your knuckles can give you arthritis.
Is she right?
It isn't true that cracking your knuckles causes arthritis, so that's a myth. No. But she's not giving bad advice because some recent studies suggest that chronic knuckle crackers can go on to develop poor grip strength and swollen hands. And of course, speaking of arthritis, arthritis is inflammation of one or more joints, and the main symptoms are pain and stiffness of the joints. Now, this may worsen with age, as many of us know, but in many cases it can be treated with medications.
Exercise and weight loss are also important in managing arthritis because carrying excess pounds puts stress on joints, which brings us to our next question. This has to do with weight.
Hi docs, my name is Susan. I've always heard that if you eat too much and become overweight, you'll get type 2 diabetes. Is that true or not?
Not true. Being overweight doesn't guarantee you're going to get type 2 diabetes, but it is one of the strongest risk factors. Even if you're at a normal weight, family history, age, high blood pressure, and high cholesterol can also increase your risk.
Type 2 diabetes is caused when the body becomes resistant to insulin, the hormone that kind of helps regulate moving sugar into the cells, or if the pancreas stops producing enough insulin to maintain that normal glucose level.
All right, let's move on to a question about drinking. This is about water.
Hi docs, my name is Nick. Do you really need to drink 8 glasses of water every day for good health, or is it just a myth?
Myth. The fact is, different people need different amounts of water. The key, of course, is to just stay hydrated.
And there's so many factors to take into consideration. How much you perspire, what climate you live in, how much activity you do, if you're pregnant, breastfeeding, if you have chronic illnesses like diabetes or heart disease. All of these things are factors that can affect how much water we need to drink every day.
And if you're wondering how much water you need, you can look at your urine. While not always true, if it's pale or straw colored, you're probably well hydrated. If you're worried about getting sick, this last question is probably for you.
Hi docs, my name is Paolo. My mom always said to grab a jacket when we walked out the door. She swore that if we didn't, we would catch a cold. Please tell me that mom is not always right.
Dr. Freda.
Okay, well, mom is kind of right. Just because you get cold doesn't mean you're going to catch a cold. But
so that part's a myth.
That part is a myth. But the viruses that cause colds really thrive in cold temperatures. Remember that what a cold is an infection of the upper respiratory system by a virus. So what you're talking about is how you catch these viruses, and they're wily. So if someone is infected or sick and coughs into the air, the viruses are there. If you, so you can catch them that way. You can catch them through hand-to-hand contact, or you can catch them by touching a contaminated surface. And then, if you touch your eyes, your nose, or your mouth, after that exposure, you're likely to get a cold. In cold weather, the lining of your nose becomes drier, and this makes it more susceptible to those viruses.
So true. We're having fun this segment, aren't we? Hey, I do that as a joke. You can prevent a cold by washing your hands off with soap and water and avoid close contact with anyone who has a cold. I do not have a cold. Dr. Freda does not have a cold at present. And the best way to treat a cold is to stay hydrated and certainly get plenty of rest. So we did debunk some persistent health myths today, but there are so many more out there.
There are so many, but we can get started. Go to gethealthystayhealthy.com. We have answers to kind of common health questions like the ones we just asked. And also there we have some information about some important topics like nutrition and managing a healthy weight, as well as figuring out how much water you need and tips on how to get enough of that water in. And of course, while you're there, you can sign up for our monthly newsletter.
And let's end with the truth. Thanks for being here. We're going to break.